latest on the new COVID wave spreading across the country. The CDC is under fire for what many consider to be confusing advice on how to handle the surge. The agency recently changed the number of days that people with symptoms should self-isolate. They dropped it from 10 days to 5. It initially said that people do not need to be tested before leaving isolation, but the CDC has since changed that. And the current guidance is that if someone has a test and wants to test, an antigen test on the 5th day is the best approach. Just before New Year's, CDC Director Dr. Rochelle Walensky told us here at CBS Mornings why there was initial hesitation about those antigen tests.
Because we don't know how this antigen performs with regard to predicting transmissibility towards the end of your period of infection. We know it performs really well during that period where you're initially infected, but the FDA has not at all looked at whether that correlate of your positive antigen really does correlate with whether you're transmissible or not.
And CDC Director Dr. Rochelle Walensky joins us now live. Dr. Walensky, good morning to you. Thank you for being here. Confusion seems to be the word of the day. Could you help us understand what has changed in terms of what you're looking at to make these recommendations shift ever so slightly from the CDC?
Yeah, first let me just say sort of where we are, and that is we have a lot of cases out there, and we believe 95% of them now are Omicron. We know that our hospitals are filling up, and they're filling up with people who are unvaccinated, 17 times more likely to be in the hospital if you're unvaccinated compared to if you're boosted. So first, I want to say, get yourself vaccinated, get yourself boosted. With regard to our isolation guidance, I remind you, isolation is for people who have had a positive test, and we have now dozens of papers that are now on our CDC website that we've reviewed to update this guidance in the context of the science and the epidemiology of our time. So what we know is that for the 1 to 2 days prior to your infection and the 2 to 3 days after your symptoms, you are maximally infectious. That's when your biggest infectious and contagious period is. By day 5 after your symptoms, most of that infectiousness, that contagiousness is really behind you. And that's really where we say, do you have symptoms? If your symptoms are better, you're safe to go out as long as you're wearing a mask all the time. Now, what we heard over the last week is many people were interested in using an antigen test. They had access to the antigen test. So we did not pivot our recommendations. What we did is we provided guidance for how you'd use and interpret that antigen test if you so chose to take the extra step to get one. And that is, if it's positive, stay home. And if it's negative, please continue to wear your mask, because that does not mean you're no longer infectious.
The word access, if you have access to, is an unusual word to find in a medical or scientific recommendation. It makes me wonder, and a lot of people have been wondering, if tests were widely available, if access was no object, would the recommendation or, in fact, the policy, to make it a little bit harder line, from the CDC be, yes, test required before leaving isolation?
You know, we require tests for leaving quarantine being those period of time after you've been exposed. What I do want to say is that we have to provide guidance that is, grounded in science, that is grounded in the epidemiology of our current moment in time, and implementable at the state and local jurisdictional level.
So if people on the 5th day of a positive test, they've been isolating, if they do not have access to a test, and they're not they want comfort in going back out there in society, they don't want to spread this thing, what's your recommendation to them? If they can't get a test, they should stay indoors?
If they can't get a test, they should wear a mask, and that's actually really what our guidance says. Isolate for those first 5 days. After those first 5 days, make sure you're feeling better. If you're feeling better, then you really can go out, but you need to go out and you need to be wearing your mask all the time. So what does that mean? It means don't go joining lunchrooms with your colleagues because you have to take your mask off to eat. Don't go to restaurants. Don't go to gyms where you might take your mask off to exercise. Don't go visit your immunocompromised or elderly family. Because those last 5 days, you still may have a little bit of infectiousness in you. We want to make sure you're wearing your mask all the time.
Yeah, Dr. Walensky, I know the CDC is balancing safety with practicality, trying to get people back to their normal lives while also keeping people from contracting COVID. You've got a lot of criticism in the last week. People have said you've been confusing. Any shortcomings you want to acknowledge? I mean, what do you say to those critics?
You know, as I said, we're working 24/7, 12,000 people to keep America safe, to update our guidance in the context of really fast-moving science and really fast-moving epidemiology. We have room we can improve in our communications of how we convey that science to the American people. We will continue to do so. We've gotten some criticism, but we've also gotten quite a bit of endorsement of these new guidance.
Yeah. And a lot of people feel really good about a 5-day isolation, because isolation is difficult on a human being. Dr. Walensky, thank you very much. We appreciate you coming back to clarify.
Thank you so much, Tony.